How you doing? My name is Gianni. I'm going to be your student physical therapist today. So what we're going to be doing is we're just going to go over a couple things just based on your condition that you came in with. We're just going to try to see some numbers and then go from there to see how to best help you get to your goal. So Joe, you are a 67-year-old male with shortness of breath, coming in with shortness of breath and minimal activity and increased fatigue recently. So you have a history of COPD with emphysema dominant, 50-year smoker, and then you are right now on home oxygen, so we're on 2 liters of home oxygen right now. So with that, I just kind of want to get, like I said, a couple numbers here and just try to figure out what we have going on, and then from there we can kind of decide what our plan of action is to get you back to, that shortness of breath. We want to get that back to as normal breathing as possible, and then increase your activity level and decrease that fatigue, the tiredness that you have. So I'm just going to take a couple measurements. So you just find right here, just relaxing. Okay, got that. So that was your heart rate I was checking. So I'll put that number in here. So we're at 86. And then we're going to just take a blood pressure measurement if that's okay. Stay nice and relaxed here. Okay?
Yeah, thank you.
Alright. It's 130 over 76. 76. And then, so since we're on that home oxygen, obviously, we just want to do this. So it's just going to test kind of your oxygen level in your body, just kind of get a baseline for that as well. So we're just going to put this right on your finger there. And then you just relax, and we'll show you the number here in a second. Okay, good. All right, so I also see, okay, because we're at 88%, so that's a little low, but that's okay. But we got an order from the doctor saying, so we titrate so if it gets under 87, we're gonna, help you out a little bit, put some more oxygen in there so you can maintain that at least 87%, because we don't want to go any lower than that because that could cause some issues. But like I said, I got an order from the doctor, so we should be just fine there. Okay, so now I'm just going to have just general look, just trying to see if there's something that I see maybe initially that maybe I want to look a little bit deeper into. So you can just relax, stay there. So I could tell right when you were coming in that we have what we call barrel chest deformity. So that is kind of just, if you're facing from a side angle here, that your chest up here is just, from the back to the front, is just a little bit wider than usual. So that is typically because of your condition, the COPD that you have, that's gonna just increase that, your chest wall a little bit, and it's gonna keep it in there. So it's like, you know how like inflammation comes, it kind of just like swells up, so that your chest is kind of just in that position of that increased lung, like hyperinflation, and then that's what I see there. So from the back to the front, it's just what we call a barrel chest syndrome. So that's something I saw. And then I also saw when we were just kind of hanging out here that you're using, when you're breathing, we usually try to use so have you ever heard of the diaphragm? So diaphragm's down here. We usually are breathing through kind of the whole chest, and I feel like for you, you're kind of breathing with some of those accessory muscles is what we call them. So it's just kind of up here, because we don't, like I said before, we have that increased chest wall expansion that we can't take big deep breaths. So you're using different muscles to just breathe normally when we're just hanging out here. So those are kind of the two things that I saw when we were going here. So that's just something, like I said, because of the condition, it happens. But I just wanted to make sure that you knew what was kind of going on, what I was looking at, okay? All right, so the next thing I'm gonna do is I'm just gonna try to I'm gonna listen to your heart and your lungs and just kind of get an idea of what they're sounding like, and if there's anything that normal or abnormal, and just kind of communicate that with you, okay? So first I'm gonna do the lung. So I'm just gonna go right here. We'll take a deep breath in and out. Good. 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 Deep breath in and out. Good. And then could I have you turn this way for me? Perfect. So I'm just going to move your hair real quick. And we're just going to up here, and then same thing. Deep breath in, out. Good. Deep breath in. Out. Good. In. Out. Good. In. Out. Good. In. Out. Good. Deep breath in and out. Good. Two more. Deep breath in. Out. Deep breath in. Out. Good. Okay, you can relax and you can turn back facing forward. Okay. Just make sure that that's okay there. So with that, what I heard was a little bit from the condition. So we're kind of, with that condition that you have, we're a little inflamed. So it could have kind of like a buildup of like mucus or inflammation in that area. So what I could tell from what I was listening to is very diminished sounds, so kind of quiet sounds, just because we can't take those full range breaths. Also, I heard a little bit of wheezing, especially when we were exhaling, so breathing out. And that just comes from, like I said, you have all that mucus and inflammation built up, that we usually hear that sound of when you're exhaling through. And then with that, it's something that, like I said, because of the condition, it's something that we just have to be aware of and know that with our breathing, we're just gonna have to be a little bit more cautious with, if we're doing exercise or something like that, that we know that might be an issue, like with certain exercises, so not pushing ourselves too far with certain things, okay? And then next, I'm just gonna listen to your heart. So with that, I'm just gonna listen to both sides. So I'll listen to this side first, and then I'll switch and do this side, okay? So it's just 4 different areas, and you can just be nice and relaxed. So if I go right here. all that sounded normal, good. I mean, there was a little diminished sound, but so we want to hear what we call like normal breathing sounds, which is like an S1 or S2. You were normal the whole time, like I said. It was just maybe a little faint, but overall it sounded good. There's nothing that we need to be worried about there. So next, what I'm going to look is just going off of what we looked at before with just, how I said you had the kind of barrel chest. So what I'm just looking for is, I just want you to take kind of a deep breath in and deep breath out. We'll go again. One more. Okay. So kind of what I'm seeing there, so the test I'm doing is just assessing the chest wall mobility that you have in your chest, so taking a deep breath in and deep breath out. So what it seems to me is, obviously we're kind of have that chest that kind of pops out a little bit more. So when you're breathing in, your chest, you're not inhaling as much. It's more, you get to a certain point, it kind of stops to where normal breathing goes, and then when you exhale, it's a little bit longer than your inhale. So that's just because, like I said, that inflammation or that mucus that's built up in that chest from the condition that you have is something that is going to cause that when you're breathing in, you can't take as deep of breaths. So it's going to be short, you'll have shortness of breath a little bit more frequently than others without that condition. But it's something that we can definitely work on. Okay, so the last couple things we're going to do is I'm just going to kind of assess how we're walking, okay? So I just want to see, we're just going to stand up real quick. We're going to take a couple steps forward, turn around, take a couple steps back, and we're going to sit down in the chair, okay? So I'm just going to look at just how we're walking and then what it looks like. Put this around you if that's okay. Okay? All right, and then I'm going to stay on this side just so I can hold your oxygen here. And then what we're going to do is we're going to stand up in 1, 2, 3. Good. And then we're just going to take a couple steps going forward, okay? Good. And I'm going to turn around. Here. All right, I'm going to sit back down, okay? Okay, so with that, obviously what I saw was we had a little bit of forward lean when we were walking, so kind of going forward like this. We were taking a little bit shorter of strides when we were walking, and then just the pace that we were walking at was a little slow, but nothing that we can't fix. So we'll definitely work on some mechanics of normal walking form, and then we'll kind of go from there trying to get just overall endurance from there, okay? And then what I would do from here for an outcome measure is I'd probably do a 6-minute walk test. I think that's a good test for just endurance and then functional capacity in general. So with this patient, it would be something where I would see, because of their increased fatigue and decreased activity levels, when we're doing the test, it's going to be below average on the distance walked, and probably 2 or 3 or maybe even more frequent rest time. So not sitting down, but obviously just kind of standing there and trying to catch their breath to continue walking. So it would be something that would be lower than the average, and then we would have to work on over time increasing that endurance, and that's a repeatable measure test that we can do anywhere in the hospital, as long as we have, or in the outpatient clinic, as long as we have the parameters with the meters with the length and the width. But I think that's a good test, and it's a repeatable test that is applicable to someone like this with COPD, with that obstructive condition that we can work on trying to build up some functional capacity and decrease those symptoms that they have when walking. So then some interventions I would do with you is, first, I would do just kind of like we did with the 6-minute walk test, we would just work on that conditioning. So that whether it's walking on a treadmill here at the clinic, maybe walking at home if I give you maybe something to do at home, as long as, you know, someone's with you, supervising you. But overall, I think that's just gonna be better for you to make sure you're just increasing that activity level, which will decrease those symptoms and, you know, improve quality of life with that. And then one technique I can show you that I'll show you if let's say we're walking and we start to experience symptoms like that, what I want you to do is a technique. It's very simple. I'll teach you right now. It's something when you start to feel those symptoms or you start to get fatigued, stop for a second and perform this and kind of do it as many times as you can in order for those symptoms to start decreasing and feel like you can continue walking without, you know, a lot of strain. Okay, so we kind of want to be in an area where we're pushing ourselves, but I don't want it to get to a point where those symptoms are starting to hinder our performance or start to cause you to, you know, like lose form or like feel like you're stumbling or gonna fall, something like that. Okay. So what it's called pursed lip breathing. So I'll show you real quick. So what you're gonna do is you're gonna breathe in 3 seconds through your nose. Here you go. And then you're gonna hold that in, and then for 5 seconds you're just gonna you're gonna whistle with your mouth, and then for 5 seconds. So in through your nose for 3 seconds, hold, and then like you're whistling out through your mouth for 5 seconds. So we'll go in through your nose, good, and then make a whistle. 5 seconds, good. One more time. 1, 2, 3. 1, 2, 3, 4, 5. Good. One more time. 2, 3. 1, 2, 3, 4, 5. Good. And like I said, this will help you just increase correct breathing, because sometimes when we get fatigued and you start to feel those symptoms, you'll have some rapid rest. So kind of getting your heart rate down and getting to your point where those hopefully symptoms diminish and we are able to continue walking. Obviously, if that doesn't help, we should stop walking and then, you know, take care of it a different way. But this is just kind of a fix that you can do quickly on your own if you start to experience any of those symptoms. Okay?
Okay, thank you.
Well, thank you very much.
Thank you so
Take care.
much. You too.
So I just wanted to mention with the 6-minute walk test, I would be monitoring the vital signs before, during, and after completion of the test. It's one of those things, especially when his SpO2 is so low, we want to make sure that it's not dipping too low when during exercise. Obviously that can cause complications that could mean an emergency. So it's one of those things where we want to be monitoring those at all times and then asking how he is symptom-wise with that dyspnea. And then with that as well, we want to make sure that we ask him on a scale of 1 to 10 what was the hardest portion of the test. And then with that, you know, when we're doing that aerobic conditioning that I talked about, we want to make sure he's at a good intensity, probably around a 5 or 6 out of 10, where he's pushing himself, but I don't want his symptoms, you know, to exacerbate. So if he starts to get past that 6 out of 10, doing that pursed lip breathing that I taught him hopefully decreases that symptoms and, you know, decreases his fatigue so he can continue to walk.